Hi everyone, Dr.Wa here. Today I just want to encourage you guys and especially speaking to the new grad RNs who are coming into nursing. I'm sure you're excited. This conversation was prompted by some events that happened at work. So everybody is aware that there's this COVID pandemic that's going on, and guys, it has been a very challenging period of time. But there have also been like beautiful moments and moments that I will always cherish all my life. But I was working last week on Sunday and I was just thinking, my assignment was really rough. And if I say rough and I'm a really seasoned nurse, it was quite a rough experience on Sunday. And I just thought to myself, wow, what would a new grad do if they were not equipped with some of the, skills and some of the, you know, camaraderie that I have developed over the years with my colleagues. So I decided, let me just share some ideas on how to survive as a new grad RN during the COVID pandemic. So what's different now about nursing than it was before? So before COVID, I could say that nursing was pretty much about really understanding your nursing knowledge, applying it, developing skills, and the patient population was not as complicated. And when I say as complicated, is that COVID is a new thing and it has really taken everybody by surprise. Nobody really knew about the disease process, and we have just been understanding the disease as we go. And then the patient population also has changed quite a bit. Back in the day, it wasn't very common to take care of a person who had like hypertension, diabetes, end-stage renal disease, and a whole gamut of other conditions, all comorbidities. But now we have patients who are coming in with really complex medical conditions, and then now add on to that COVID pneumonia. So it makes that patient's care really intense. So at the height of the pandemic, many hospitals were overwhelmed. The facilities that I worked at were really overwhelmed. I mean, during some days we had no beds, like literally every single unit was packed to the gills and there were still patients waiting in the ER. So we had to do what we needed to do. One of the things that happened is that back in the day when I started nursing, there was a cap, and by a cap means there was a limit on how many patients an RN could take care of depending on the unit they were in. Like, for example, if you are in medical surgical, you were capped at 5 patients. If you are in telemetry DOU, which is a cardiac unit, you are capped at 4, maximum 3 sometimes. If you're in ICU, you are capped at 2, maximum 1 ideally. Now the caps have kind of been, they're not realistic. It's not realistic to have a cap when you have a whole bunch of patients waiting to receive the same quality of care. So the caps, there was, in the state of California especially, the whole cap thing was just nullified for the period of the time that the pandemic was going on. And I'm kind of hoping that they bring back the caps, because really, guys, it becomes a rough shift when you have a maximum of 5 patients on a DOU unit. I mean, anybody who's been a nurse for any period of time will understand that this is hard. But with that said, there's a lot of good things that have come out of this whole situation. I think most of my colleagues and most of my friends working as nurses, we have really learned how to work together. When somebody's faltering on this side or somebody's getting overwhelmed, we'll pick up the slack. It's such an interesting situation, because before you were so focused on your patients that there was no time or room to think about another person. But now you have no choice, because if you don't say, hey girl, come and help me, let's move this patient, or hey friend, come here, like let's help this patient to the bathroom. If you don't do that, you will be overwhelmed. So I want to give you a few strategies, not many, a few strategies that you could use as a new grad that will help you survive being a new RN during the COVID pandemic. Number 1, always remember why you are there. When you calibrate your mind to be present, to remember that you are there to provide care for a patient, to support families, and to be the best nurse that you can be, because that is the reason why you went into this profession in the first place. Such that when you remember why you're there and that the patient, it's all about the patient and not about you, you'll be able to remove yourself emotionally from situations that might come across as challenging, For example, a patient may come in and they're having a really bad day and they're not in the best mood and they're not the most polite at that time. And instead of taking it personally, you can choose to, be okay with it and just, shake it off and go on to the next patient without taking it personally. Because at the end of the day, it really is about the patient. Number 2, self-care and how to manage your stress. I always make sure I take my breaks. I mean, no matter what, take time to go to the bathroom, because that's one of the things that new grads always struggle with. And I remember as a new grad, I had the same problem where I started my shift at 7:30 and it's now 6 p.m. and I still haven't used the bathroom. I haven't drank any water and even I haven't had anything to eat. Because as a new grad, you're still learning how to plan and strategize and how to organize yourself so that you can get your tasks done. And at the same time, do the assessments, communicate with family, communicate with physicians and other care providers. And you just found yourself totally forgetting to even eat, use the bathroom, and such and so forth. It is important. Guys, you are of no use to anybody when you are famished, not able to concentrate, and you haven't had a break. So take the time to catch a break. You can always go to another colleague and say, hey, by the way, I haven't really eaten, I haven't used the bathroom. Do you mind eyeballing my patients? I'm just going to take a few minutes. It is important. And in fact, most hospitals now are insisting that you have to take your 30-minute lunch break. And I know sometimes this is a reality. Nurses will take a sneaky lunch break where you kind of like take your computer and continue chatting, because if you stop, you'll probably wind up not being able to finish on time. But I strongly encourage you, remember, nursing is a 24-hour profession. Whatever you are not able to get to, be honest and candid to the next person who's taking over so that they can complete the task. Number 3, I just want to encourage you guys to know your information. When you receive a patient, make it your priority to know what's going on with the patient. I can't tell you how many times, even as a new grad, it's end of shift and I really don't know anything about the patient. The only thing I know is that I check the vitals, I empty the urinal, I know the eyes and nose, but really, truly what is going on with the patient is kind of like, it's fuzzy. Be very clear and take the time to understand what is going on with the patient. The more you know about what's going on with the patient, and this is a skill you will have to develop, you'll have to move your mind from task-oriented type of work where you just pass meds and run around the whole day, giving waters, passing meds, emptying urinals, helping put to the bathroom, but you really never took the time to read your patient's history and physical. So you really don't know, but you can have an idea because you were told in report. Take the time to get that information for yourself. That will save you a lot of problems. And when you can't, just tell the oncoming nurse, hey, this is what I was told in report. I really never had a chance to look at the HNP, but I think this could be what brought the patient, but at least at the minimum, guys, just find out what brought the patient to the hospital in the first place. That will save you a lot of agony. Number 4. Always remember to count on the divine. Guys, I cannot tell you how much I take time to call on the divine, because there are some things that are truly beyond my control. And to be okay, to trust the divine to be able to walk me through whatever challenges I have to deal with. So I know that we're going to get through this COVID pandemic. The human race and the intelligence that we've been given by the divine has given us the capacity to surpass anything. I mean, there have been disasters after disaster. COVID is another one. We're going to get through this. But in the meantime, as we deal with it, I want to encourage you guys to stay focused, know your stuff, ask for help, and take care of yourself, because life is good, love is even better, and happiness is you.